We're going to pierce Angie's ears. She's got 2 existing holes. We're going to aim for a hole right smack bang in the middle of the 2 holes she has. The first thing we do is sterilise our work area, and we sterilise the gun. We make sure we have the right insert for the size of the earring. This is pink, which is for small. The earrings are a size medium, so we need the white insert. In this particular gun, the inserts are inside. So we put the insert into the gun at the top. Make sure it's secure. Make sure we clean all around that, the handle. And even though we have gloves on, we make sure we clean our fingers. And now we get another medi swab and we clean Angie's ears. As we're cleaning them, we're looking for any contraindications, precautions that we need to be aware of. These are the earrings that Angie's chosen. We'll get those ready to go. And you can see they're in a sterile box. We don't touch them at all because they are sterilised. The first thing we do, we get a skin marking pen and we mark the position of the hole that we want to put in Angie's ear. And we can wipe it off and redo it as many times as we need to until we're absolutely satisfied. You've only got one hole on this side. Yeah. So Angie only has one hole on the other side. We don't have to get in the middle of anything. We just have to make sure that the distance between the first and second hole is identical on both sides. So we get a ruler. And in this case, I would measure from the first to the last hole and then make sure that the middle one is exactly in the middle. So now it's time to load the gun with the earrings, which we pull out of their sterile container, making sure we don't touch them at all. We hold them this way, place the actual stud into the gun, holding the gun upright so the stud doesn't fall out. And then we put the clasp in at the back. The goal is to do this very quickly so that the client doesn't get upset and doesn't overreact to the pain. So we hold the gun very much horizontally to where we want it to be. We aim it so that the stud is going to go directly into the spot where we've marked. We support the ear. We pull down to release the stud from the back. If you try to pull back out, you're going to rip the earring out of the hole, so you always pull down. Now put the other earring in the gun. You have to pull the trigger backwards to allow room to put the stud in, keep the gun upright. We have the clasp and the earring And we're now going to pierce Angie's other ear. So we support the ear, line it up with the stud going directly into the hole at a horizontal, completely even horizontal level, and drop down. If the earring sticks to the back of the gun and you find it difficult to pull down, you do have to just flick the ear and the clasp at the back up out of the gun. It is quite common with a lot of these guns that this happens. So you just flick the ear up and still drop your hand straight down. Don't try to lift outwards. So now we bring a towel up towards the ear. We squirt the antiseptic solution without touching the earring. Pick up any of the drops with the towel and make sure you get the rear of the stud as well. And you would advise your client to do this 2 or 3 times a day for the next 7 days. And after 24 hours, they're to turn the earring inside the ear 3 times a day, but wait 24 hours before touching it.